In our previous video, we presented convincing evidence for wearing masks to prevent further spread of COVID-19. With Mask Out, our hope is to make mask wearing the new norm. Here, we describe the proper way to wear and remove different types of masks to maximize the efficacy and to keep you protected. The two main types of masks used in a medical setting are N95 respirators and surgical masks, also called procedure masks outside of the operating room. ASTM guidelines can be referenced when choosing the right mask to wear. These should be reserved for healthcare workers and those on the front line of the COVID-19 pandemic. For community use, DIY masks or face coverings are recommended. N95 respirators are certified by the National Institute for Occupational Safety and Health to filter out 95% of airborne particles. Surgical masks or procedure masks are worn by healthcare workers in caring for patients or during procedures. It is intended to protect both patients and staff by preventing transmission of bacteria in the form of liquid droplets or aerosol from the wearer's mouth. In the operating room, these masks prevent the contamination of the sterile field and also prevent splashes of blood or other bodily fluids from patients to operators. Both types of masks are disposable by design and should be worn for only one patient procedure or visit and be replaced if it gets wet or soiled. Community members should be wearing DIY masks or face coverings while in public settings, along with abiding by social distancing and practicing good hand hygiene. These should cover the nose and mouth and extend underneath the chin. It should fit snugly but comfortably against the side of the face and be washed routinely. N95s are usually round or duck-billed and should form a tight seal around the nose and mouth when properly fitted. Some have an exhalation valve. Surgical masks are usually pleated to expand over the nose to under the chin. They are secured to the face with ear loops or strings tied behind the head. They are 3-ply. 2 layers of non-woven fabric surround a centerpiece of melt-blown polymer, a fine mesh that reduces the inflow of infectious particles. N95s contain a similar inner layer. The nose region of both types of masks contain a small, malleable metal piece to securely fit around the bridge of the nose. Before wearing a mask, make sure it is correctly oriented. For surgical masks, the lightly colored side should face out and the white side should face in, with the pleats falling downward, also called waterfall pleats. Ensure that the colors in the pleats are in the right orientation with the nose piece at the top. Wash your hands properly for 20 seconds as shown in our first video. Dry your hands. Remove the mask from its box or container, making sure it is the right size. Make sure the orientation is appropriate. Cup the mask in your hand with the earpieces, headbands, or ties hanging freely. Position the mask under your chin and the nosepiece in the bridge of your nose. While holding the mask in position, hold the top headband over your head and rest it at the crown of the back of your head. As you continue to hold the mask in position, pull the bottom headband over your head and rest it around your upper neck, below your ear. Position the mask under your chin and the nosepiece on the bridge of your nose. Using both hands, mold the malleable nosepiece to fit snugly against the nose bridge and face below the eyes. Ensure a proper seal. Do not leave gaps under the chin or around the nose. Cup the mask using both hands and exhale sharply. You should not feel air between your face and the mask. If you do, readjust the nosepiece. Once you have completed your duty or public outing that required a mask, remove it by first unhooking the earpieces, overhead bands, or untying the strings without touching the front of the mask to not contaminate your hands. Dispose of the mask into a trash bin, kick basket, or in the case of a hospital setting, use a designated biohazard disposal bin after caring for COVID-19 patients. Wash your hands properly for 20 seconds after handling the mask as shown in the beginning. According to the CDC, under the current circumstances, medical-grade masks can be reused up to 5 times using a UV sanitizer. DIY cloth masks should be washed and dried regularly using dishwashing soap or detergent.